Hi guys, I'm here today with Dr. Paul Griffin. Good evening, Dr. Griffin. Thank you so much for joining me. With the winter season approaching, we often witness an increase in cases of influenza, the flu. Could you help us to understand why there is typically such a surge of flu cases during this time of the year?
There's a few factors that contribute to the seasonality that we see with influenza. Some of them relate to the virus itself. It does like to survive for longer periods of time in colder temperatures with lower humidity, for example. And then part of it is changes in human behavior that we see during the colder times, where people are more inclined to be indoors in closer proximity with poorer ventilation, for example. So both of those things mean transmission is much more likely to happen in winter and accounts for why we do often see a really big peak in wintertime.
And what potential preventative protocols do you think that we can adopt?
There's a few things we need to consider. Certainly for those viruses for which we have a vaccine, that's really the backbone of our approach to trying to minimize the consequences. Basic infection control principles are really important. And for some of these infections where we don't have vaccines or treatments, that's really all we have. So things like social distancing, hand hygiene, cough and sneeze etiquette, for example, but even things like focusing on ventilation and perhaps most importantly, staying home when you're unwell can certainly help to limit the spread of all of these viruses. I think because our approach can be slightly different with the different viruses, that really highlights why testing and knowing which virus somebody might have is really important.
Could you provide some further insights into the concept of sensitivity and its relationship to these tests?
The sensitivity really relates to the test's ability to find whatever it is we're looking for. The more sensitive the test, the better it is at being able to detect, in this case, the virus SARS-CoV-2. A sensitive test can detect lower amounts of virus and do so more accurately. And that's really important because we don't want a test that's poorly sensitive and then may miss people who are infected and might be infectious, and perhaps false reassurance of getting a false negative and those people going out into the community could
Yeah.
really contribute to the spread. So sensitivity in terms of these sort of tests is perhaps the most important attribute.
Could you provide some insights into these new testing concepts?
It's really important that we now move beyond just testing for COVID-19. For so long in the pandemic, that was really the only virus we were concerned about, but that's clearly no longer the case. This year, we've seen quite high rates of RSV or respiratory syncytial virus, and particularly at the moment, we're seeing quite high rates of both flu A and flu B. And the trouble with all of these viruses is we can't tell them apart by how they present. We can't tell them apart by symptoms. And because we have them all circulating, we can't just assume people have one or the other. And the management of these viruses is vastly different. We have antivirals for the flu and COVID. They're different, of course. So it's really important to distinguish those. And also the infection control recommendations can be quite different depending on which virus people are infected with. So that's why it's more important perhaps now than ever that we have tests that don't just look for COVID or even COVID and the flu. Looking for all three viruses is really important.
So, Dr. Griffin, when considering the TouchBio dual combo rat, how does it compare to other brands available on the market?
Yeah, this test has a number of really important attributes. Of course, the most obvious one is it can find multiple viruses. And as we've moved beyond just worrying about COVID, that's really important. But it also does so with a very high sensitivity and specificity. They're the main things we judge a diagnostic test against. And in this case, that's above 98% for both of those values, which is quite exceptional. And then you add to that the ability to do that in people's homes and do it quite early on in the course of infection because it is so accessible. I think this test has the potential to make quite a big difference.
Well, thank you, Dr. Griffin, for providing insights into the TouchBio dual and triple combo rats and their remarkable sensitivity for detection capabilities. It's evident that these tests offer a valuable solution for accurate detection of multiple respiratory viruses, facilitating more effective healthcare interventions. We really appreciate your time and your expertise on the topic.
A pleasure. Thank you.
Thank you.